All right. Good afternoon, everyone. Welcome to the Pharma Talk. My name is Karthik Yaga. I'm one of the vice presidents of pharmacy retail operations here at McKesson. I view myself as a business consultant for pharmacy customers as well as McKesson customers. Here to talk about some really cool services and solutions that we offer. And I'm pleased to be joined here today with John and Natalie. Before we get started, John, Natalie, can you introduce yourself to the audience? Tell a little bit about your pharmacy practice.
Wanna go first?
Sure. My name is John Martin. I'm owner and pharmacist at Bryant Family Pharmacy in Bryant, Arkansas.
Yeah, and I'm Natalie Novak. I'm a clinical pharmacist at Bryant Family Pharmacy. Just wrapped up my PGWare1 community-based residency program and staying on. We offer a lot of innovative clinical services in addition to being an independently owned community pharmacy, several of which I started during my residency. Really proud of all the success that we've had, and that's what we're here to talk about. So.
I'm excited as well as, the last couple of days we've been talking about diversifying revenue in your pharmacy practice. And here's a really cool solution service that you've been able to implement at your pharmacies and serve the community. We're here to talk about prescriptive authority in pharmacists. And yes, you are in Arkansas, a very progressive state, which is fortunate. So let's begin and, share with us, John, Natalie, on how did you implement the services? How did you decide on where to start with? And just share with the audience some of the success stories.
Yeah, I guess I'll start. That's very loud. So when I moved to Arkansas for my residency, I discovered that there was, a very wide scope of practice for us. We're very lucky in the state of Arkansas to have several statewide protocols for pharmacist prescribing. So our prescribing authority started with a statewide protocol for prescribing naloxone. Then that expanded to test and treat for flu and strep, and then to oral contraceptive prescribing, and it's expanded even more from there. And so when I started my residency, that's the direction I wanted to go with my projects for the year. John kind of let me just take those and run with it, do whatever I wanted to do, and it ended up being very successful. So started with naloxone dispensing, and that evolved continually over time, but we found a way to trigger and identify patients that are eligible for naloxone that could benefit from that we could also medically bill their medical insurance for a 15 to 30 minute consultation, basically the counseling that you provide on a regular basis to your patients that you're dispensing naloxone to. So that was a big step forward for us is, getting paid for your time talking to the patient. And that's, where the future of the practice is going. So.
Awesome. Just, you touched on a few things there. It's a new service, it's innovative. What kind of, like from a HIPAA standpoint, from a patient compliance standpoint, pharmacy regulation standpoint, where did you guys get your support from? How did you deal with that?
Yeah, sure. So, like she said, the statewide protocols were already in place for us. That helped a lot on that end of things. And then just understanding the ins and outs of the medical billing aspects, understanding like what the expectations are as far as those encounters and HIPAA secure rooms and all those things, being able to tackle communicating with patients at the drive-through even and what that looks like on the medical billing side of things. It's a little bit different world, but we're kind of trudging through it. So.
Yeah.
Awesome. What about your team, John, Natalie? Like, how did you get your team on board? I can only imagine when you started talking about prescriptive authority and bringing in all these new services, your team would have been like, oh my gosh, what are we getting into? How do you reinforce, reassure them, get them the training, make them comfortable with it? And you two are here today. How's it going back in the pharmacy? How did that roll out?
Yeah, for sure. So that was a big challenge initially, starting this naloxone, it initially started with mainly me managing this service by myself. Didn't have a whole lot of support as we started piloting it. As we continued to grow, we continued to automate it. My clinical technician does a lot of the work behind the scenes on that now. So it's fully functioning without me even being there. I'm sorry, what was the first part of your question again?
In terms of like training.
Training, yes,
yeah.
and buy-in. It was very interesting to get pharmacist buy-in in the beginning. There's a lot of stigma around naloxone, prescribing naloxone in general, and there's a lot of stigma that patients feel as well. So I spent a lot of time with my pharmacists and technicians one-on-one, training them of how to have these conversations with our patients and how to frame it. And I kind of found that pharmacists are kind of split in two different camps. Some are very public health focused, care about the public health benefits of the programs that we're doing. So, playing onto that of how naloxone benefits the community is a great strategy for those types of people, understanding their strengths. And then another camp of people, care more about the profits and the margins and why does this benefit the business. And so being able to show the value and show the ROI for these services was, a big thing for them. So, and then also training them on the counseling to really help get them on board. It's just a total mindset shift of, product-focused dispensing to service providing.
Awesome. John, maybe if you can touch on the strategy, right? I know Natalie mentioned starting off with naloxone. How and when did you want to expand the scope of that? And if you can touch on some of the different services that are going on today outside of just naloxone.
Sure. So we started with naloxone really because that was the easiest to identify. Those patients were easy to identify and easy to mark within our system. And then from there, we kind of expanded on to test treat, some of the different immunization consultations, and now even oral contraceptive prescribing. So we've set up appointment-based models for all of those. Patients can get on our website, schedule appointments, and then we get notified of when those appointments are going to be, and our team can handle it from there. So started off with naloxone really because easily identifiable and an easy conversation to have with a patient, and then just kind of expanded on from there.
Yeah, it was a great way to learn the medical billing process as well and navigate that landscape when you've never done it before. I was from out of state and had to learn all these regulations kind of on the spot, and it felt like a comfortable place to start. So
Awesome. When I walk into a pharmacy, oftentimes the barriers of owners and pharmacists is like, this is going to disrupt my workflow. I have this set up for the last 5, 10, 15 years, and I don't want to start over again. How do, for the audience here, how did you get over that barrier of workflow? Did you have to make any changes? Talk to us a little bit about that.
Yeah, so we were able to actually integrate most of our identifying of patients within our workflow. So we were able to use some triggers within our pharmacy processing software. It identifies it for the technicians, for the pharmacist, even at the check stations, and that way, really it was able to go into our workflow pretty easily and identify those patients. We can then have those encounters with them and step off to the side for the medical billing part of it. It really went in a lot easier than we thought it would.
Yeah.
Honestly. And the uptake was a lot more than what we thought it was going to be too. We really didn't think that. We were surprised with the number of patients that were receptive to talking about naloxone and Narcan prescribing. So.
Okay, that's awesome. I mean, reassuring, obviously, with not making a ton of changes to workflow and introducing it. Seems pretty easy to do from hearing from both of you. What, if any, were some challenges that you faced today, if any, and if there were in the past that you overcame?
So the big one that we kind of ran into was understanding the difference on the medical billing side of things as to what a consultation is versus like a pharmacist or like what we consider counseling, right?
Yeah.
So it's a little bit different on the medical side and what their expectations are when it comes to the setting and the HIPAA compliance and being in a separate room. You can't necessarily do it at your pharmacy countertop and some of those things. That was a little bit of a challenge, but once we figured out some of those logistics and how those warm handoffs go and how we can kind of transition, we were able to get through most of that. So
Awesome. So with diversifying revenue and diversifying business being top of mind, I'm sure there's questions in the audience, but help us just get started. Like, I'm a dispensing prescriptions pharmacy. Where do I go? Where do I get started? And how do I get started?
Yeah, I think the first step is knowing what you can do in your state, knowing the authority that's allotted to you. That's very important. So make sure you're familiar with your state laws, and make sure you're familiar with your pharmacy management software and what you can do. I think that's a big takeaway from today. Is there's a lot of people out there that are using softwares and they're not aware of the full capability of being able to identify these opportunities for their patients. And it's really built in there for you. You just have to utilize it. So that's a great place to start. As far as the medical billing goes, that's also kind of state specific, depending on what organizations you're in and the payers in your state. We're very lucky to have a great state health benefit plan that has pharmacists on staff that really care about pharmacist prescribing and being able to get reimbursed for these services. So I just encourage you guys to really build relationships with those payers and make sure that contact is there and that they're aware of the goal and where pharmacy's going.
Awesome.
one thing to add to that too is that even with that, we were kind of surprised at the number of patients that are willing to pay cash for those services. We've got a significant number that will come in and whether their insurance covers it or not, they'll pay cash for a test because they don't want to have to go to urgent care and sit and wait for that extended period of time where they can walk in the pharmacy and get tested in just a few minutes.
That's a great point. So you're saying we can get started off with just cash paying if you needed to while you work towards the medical billing and stuff like that.
Absolutely. You'd be surprised the number of patients that will pay for convenience over, especially with oral contraceptive prescribing, it can be a 3 to 6 months wait time in the Little Rock area just to get in to see an OBGYN. And so if we can bridge that gap and get a young female patient access to oral contraception in the meantime before they can get in to see a provider, then that's what we're there for. We're there to bridge the gap.
Awesome. Quickly touch on the prescriber collaboration, right? Like, how did you get the word out there? What was the reaction from the prescribing community? Because that's yet and often a barrier that people perceive. I don't know if it's truly a barrier. It's perceived that, hey, the doctor, the urgent care down the road may get upset. Were they? And if not, like, how did you guys collaborate and make that partnership?
Yeah, so we haven't had a whole lot of pushback from the providers in the area as far as kind of taking up some of that off their plate, allowing them some time to have better encounters with some of the patients that maybe need it a little bit more even. So as far as that component of it, the marketing, we've done all different kinds of things. Social media posts, obviously, that's where a lot of dollars are spent these days. We had a ribbon cutting with our Chamber of Commerce for that aspect of our business to kind of highlight something different and a change. So it worked out well, and I think that there's lots of different avenues for
yeah, absolutely. And, being a family business, we have a lot of great relationships in the community. And even, I had an instance recently where a child was seen at the pediatric clinic behind our pharmacy, and they referred the mom to us to get tested because we can prescribe treatment. They can't necessarily, as a pediatric clinic, treat the parent in addition to the child. So I'd say that the reception has been great. And I think it's all about how you communicate that, we're not trying to scope creep. We're trying to bridge the gap. We're trying to help your patients have better access to care, and that's what's important.
That's very reassuring to hear because I can tell you, speaking to a lot of pharmacists, they fear these barriers, and until you start communicating and having these conversations with a lot of the prescribing community, you really don't know what's out there. Well, John and Natalie, thank you for sharing this amazing journey with us. I'm sure there's audience here who's wanting to get into this field of prescribing authority based on your state laws and regulations, but here's a starting point. We'll ask any questions from the audience right now.
Are you required to get any certifications from the payer? Do you have to go through a process with each payer to get certified? Or I'm sure you're familiar with CPESN. Can they help you get certified and you be certified for all of them?
Yes, so we are a CPSN member pharmacy. We have one large payer in the state that we can medically bill to, so it's only one payer we've had to get credentialed with so far, but that is kind of a lengthy process. It's a lot of paperwork to submit to them. They need a full resume, they need your liability insurance, they need all kinds of things to submit and verify you as a clinician, they set up your pharmacy as a clinic essentially from the payer side. So every payer is going to be a little bit different, but that's at least how it works in our state. And then there are a lot of different opportunities through CPSN and different programs like that. So great to hear that you're bringing that into play, specifically with e-care plans. There's a lot of different programs ongoing that kind of vary state by state.
And one more question. What billing platform do y'all use to bill the medical claims?
So we don't currently pay for a medical billing platform. We utilize Availity, which is essentially a clearinghouse for medical claims. I found that once you're trained on the basics of medical billing, it's not that difficult, and my technician does a lot of it for me. So it's a great role to elevate technicians in your business if you do have that opportunity. John may be able to add on to that, but it's been pretty easy process. I can submit a medical claim for naloxone or a testing and treatment appointment in about 30 seconds.
Yeah, no, I mean, she kind of hit on it there, exactly that. It's a great opportunity to increase value with some of your team. So bring in your technicians that maybe are doing immunizations that maybe want to jump in and join in with the medical team and help with the clinical services.
I can't.
sorry.
Sorry, can't hear you very well.
Something to kind of increase the morale of a few of my technicians. They feel the others are maybe more important than they are, so that gives me a good idea right there.
Yeah, anything that you can do to empower your techs to increase their worth within the pharmacy, it's a great idea for sure.
I just want to double click on that question. I think that's a great opportunity today with pharmacy technicians who want to do more and they feel kind of stuck in what they were doing and just filling prescriptions. But to your point, John, I think it's a great way to show them that, hey, there's more than just counting pills and putting them in a bottle. The profession of being a pharmacy technician is just more than that, and here's a great way to elevate that profession as well. Any other questions? Amazing. Thank you for joining and attending this afternoon. We'll be still here if you guys have any additional questions. At 3:30, there will be 3 o'clock, I think. Sorry. Yeah, 3 o'clock. There'll be another session at the back door if you guys want to join. But again, thank you for your time today.